Welcome back. This is Morning Express and it's time to talk about your health. Today is World Tuberculosis Day 2021, a day that is meant to raise awareness about this respiratory condition, and we're going to dig into it. Your health is the segment. We take a look at that. The reason why this is very important is because according to WHO, 1 million is the estimated drop in TB treatment enrollment in 2020. That has been tied to COVID-19, given that a lot of people have similar symptoms when it comes to COVID-19, and therefore there's a genuine fear of going to hospitals and being classified or being put into isolation. There's so many other things that go into this. We have 32,000 being TB deaths recorded in Kenya in 2019 alone, including 13,000 deaths among people living with HIV/AIDS. And that tag also is responsible for the stigma that surrounds tuberculosis. We also have 140,000 people is the number of people who fell ill with TB in Kenya in 2019. And interestingly, 60% of these are male, 28% are female, and 12% are children. Now, with me in studio to shed more light on this condition is Dr. Brenda Mungai, who's the director of TB and Lung Health Center for Health Solutions in Kenya, as well as Dr. Jeremiah Chakaya, who is the CEO of Respiratory Society of Kenya. Now, if you have the paper today, when you flip to page 2, there's a lot of information on tuberculosis this morning, but I'd just like to pick one of the people who have been highlighted in this particular story this morning. That is one Daniel Ngetich. So apparently Daniel that's what I'm going to use this morning as our case study. Daniel caught tuberculosis from his brother. Now, after going through treatment for 2 weeks, he decided he's feeling better, so he decided not to go on with the treatment. Little did he know that this was a crime. Before he knew what was happening, he was being visited by his area chief and being thrown in jail. The charge was that he was endangering the public. Unfortunately, behind bars, he was mingling freely with other inmates, and this took a span of 2 weeks. Before you know it, he was out back in the public, weak and in need of moral support, but his wife and children ran away. He also experienced a lot of stigma from the community surrounding him. And this is a typical example of what suffering from TB is like in the country. And of course, we have the reason why he fell off his treatment because he wasn't sensitized or told why it is important to keep up with treatment. So we're going to start from the basics and then get into treatment and all these numbers and make heads and tails out of them. I'll start with you, Dr. Brenda Mungai. Could you define for us what is tuberculosis?
Okay, thank you very much. So tuberculosis is an infectious disease that you get from inhaling actually the TB bacteria. The reason we actually celebrate today is when the bacteria was discovered by somebody called Robert Koch. So once you inhale the bacilli, it then can either, get into your lungs, making you ill, and that's why more often than not, the common symptom for TB is actually cough. Okay. It could also lead to weight loss, so unintended weight loss. You also get drenching night sweat, so you actually wake up at night really wet. And then, fevers. And for some, you relate it to coughing out blood. That was what was always preached before about TB.
Yes.
But it's not necessarily so. And one of these symptoms can occur without the other. But I think it's having the high index of suspicion. But TB as a disease can affect every part of the body except the hair and the nails, actually. So you can have TB of any organ of the body.
Except hair and nails?
Yes.
Wow. And so that means the symptoms also vary depending on what kind of TB you have. Now let's get to, from the story I've just highlighted from the paper this morning, Daniel was not sensitized on the importance of treatment. I'd like Dr. Chakaya, I hope I'm not butchering your name, to explain to us about actually, before we get into the treatment, explain to us why 2020 and 2021 are not the best years to be having these symptoms for COVID-19, and actually how they are impacting the number of people seeking treatment for TB.
Thank you. I think in March or rather at the beginning of last year, 2020, the world woke up to a new disease that as a new entity was frightening because it was pushed to the world in terms of communication as a deadly disease, and that's COVID-19. Unfortunately, this disease has similarities with tuberculosis. The symptoms can be similar,
yes.
And often are similar. Cough is a prominent symptom in both tuberculosis and COVID-19. But I think even much more importantly were the measures that were put in place to try and control COVID-19. There were travel restrictions and curfews and all those things. And the combination of fear for COVID-19 and the restrictions that were put in place to try and control spread of COVID-19 meant that fewer people were being diagnosed with TB.
Right.
And that's what has caused the shrinkage in numbers that we have seen at the global level and also in this country that are being diagnosed for TB.
Okay.
It actually means that a lot more people have chronic disease there, they continue to be sick for a very long time, and there will probably be a lot more people dying from tuberculosis when they should not die from TB because this is a curable condition.
Okay, Dr. Mungai, could you explain that bit that he has mentioned? People might die of TB when they are not supposed to be dying. Explain to us more about this phenomena.
Yes. So as a country, as you rightfully said, we got about 73,000 cases last year. We actually, it is estimated that we have 140,000 people with TB annually.
Right.
So one, it means there are people we are not diagnosing. So either they are missing out through the health system, they're not coming to the health system to seek care when they have symptoms. Sometimes they go to a chemist and buy medication when they have cough. And so it prolongs the process of actually getting diagnosis.
So they treat the symptoms?
Yes, they treat the symptoms. They buy over-the-counter cough medication. They also buy, sometimes they're actually given steroids, and this is really a big problem because the steroid will cause you to stop coughing for a while and you feel better, but you're actually exploding the disease within.
Well, for how long can one carry that on before it actually explodes?
So I think, and this is the biggest problem about tuberculosis, is it's a slow progressing condition. So unlike what we've seen in COVID, where somebody gets ill and within days, you can actually know that they're sick. In TB, you can inhale the bacilli and live with it for, first of all, you can live with it for years. So because we have people who inhaled the bacilli, they have the infection, but they do not get sick with the disease. So that is what we call latent tuberculosis.
But does it eventually manifest?
To some,
yeah,
but not to everyone. So
this
it depends.
Person who has inhaled it, can they be spreading it?
So the thing about TB, and now we have to learn a bit more. We've always thought that the latent TB ones don't spread it because they don't have symptoms. Yeah, and this will now be there'll be more research on this, just because we've seen in COVID that you can spread when you're asymptomatic.
Yes, but
so far it's the ones who are symptomatic who spread the disease further. One, because they'll cough, as they sing, as they interact, they'll get that bacilli out. So actually, the things that we are teaching about COVID also apply for tuberculosis.
Yeah, and speaking about that, you're saying they apply across board. Now, it's a crime not to go out through with your treatment. This man, Daniel Ngetich, was thrown behind bars and was mingling with other people. So, I mean, how does that work? Because when you get COVID-19, I mean, you are isolated, told to stay away from people. I mean, they were very keen on ensuring that happens. But when it comes to TB, it seems like we're not being very careful, are we?
So I would like to, to quote that case and actually just say that over time, because TB treatment is for 6 months,
yes,
and for it to be effective, you must take the 6 months. Unfortunately, when you take for 2 weeks, 1 month, you actually feel better. but the bacilli is not completely destroyed. So you must take for 6 months. And hence, from a public health perspective, there was reinforcement to just ensure that people can take medication for that time. I must say the jailing used to be there then, but I believe about in 2016, 2017, the ministry actually came up with a document that said how you will ensure, people can take medication.
Yeah.
So they actually, part of the things was to ask the counties to have places where they can keep these people in isolation to take the medication.
Okay.
So yes, there was that happening before, but now it doesn't happen. It's actually about isolation and completion of treatment.
Okay.
But more importantly, to just help the public understand and the patient understand the importance of taking the medication for the full duration.
Okay. Dr. Chakaya, the statistics that we have shows that 60% of those who get TB are male, then we have 28 female, and then 12% children. Explain to us those proportions and how come male are taking the chunk of the numbers of tuberculosis.
So that observation is global. It's happening all over the world. Males seem to have higher rates of TB than females. We don't quite understand why that is happening. There's been some hypotheses, some speculation about why that is happening. One of the things that is thought to play part here is the fact that in many societies, healthcare seeking behavior for females is different from those of males. So it may just be an issue of underdiagnosis of tuberculosis in women. However, the much more likely thing is that somehow women are a little more protected against tuberculosis than males. And maybe the whole story about infection and how you acquire it is different in males and females. Males have a tendency to do certain things that females don't do. So we tend to engage in high-risk behaviors. We spend a lot of time, sometimes in pubs. We smoke tobacco. We tend to eat a little more, and we have diabetes and all sorts of things. All those combined tended to increase the risk of tuberculosis in males.
Okay.
So it's a global phenomenon. If you look at tuberculosis in younger populations, so children, for example, the rates of TB in males and females is equal, which basically means it's either some form of hormonal influence, but much more likely a behavioral thing.
Now, let's get into the treatment of it. Dr. Mungai had mentioned that as you get through the treatment, you tend to feel better. Explain to us why tuberculosis requires such a long regimen and perhaps what it takes for one to get from having been diagnosed with tuberculosis to a point where they do not have it.
Okay. So first of all, diagnosis. Let me start with diagnosis. The way that you diagnose tuberculosis is through sputum. So especially when you have the lung condition, which is the most common, what we call pulmonary TB. So sputum is taken and taken.
Dr. Mungai, we seem to have a problem with your microphone. So as we sort that out, let's get Dr. Chakaya's take on this one, the treatment.
So the treatment for tuberculosis is lengthy, but we want to celebrate in the TB world that we have actually reduced the duration of treatment for TB. When I was a young doctor, we used to treat people for 2 years. Then it came down to a year, and now it's come down to 6 months, and in the next hopefully 2 to 3 years, it'll come down to 4 months. So we are going down, and in terms of the duration of treatment. And why is this so?
Yes.
The tuberculosis germ is a very smart germ. That's why it's been living with humans for ages, and we haven't been able to get rid of it. When you have a population of TB germs in the body, they exist in different forms, as it were. They are those that are multiplying. If you want, you can say they are getting babies. And those are the ones that you can kill with your TB medicines very easily.
Right.
And then there are those that are half asleep. They are not growing that fast. They're kind of like half asleep. And those ones are not killed by the TB germ. They will wake up one day and start multiplying. And you have to wait until they wake up to start multiplying for you to kill them. And then there are those that are completely asleep. Now, all of them will at some point wake up and do something. And when they wake up to start multiplying, that's when your TB medicines work. So that's how that waiting for these germs to wake up and to start multiplying, for them to be able to be killed by TB medicine, is what makes the treatment so lengthy.
Yeah, and what does it do to the body? Because I do understand for some people not wanting to take the medicine is because of how they feel when they take the medicine. Does it have any effect on the body of the person that's taking it that would make them not want to go all the way through?
So the major reason why people stop treatment, especially for the usual form of TB that we have all over the world, what colleagues will call drug-susceptible TB, which means the TB germs can be killed very easily by the usual medicines for TB that have been there for a long time. Now, the major thing that makes people not continue taking this treatment is, one, they have not been told that they need to be taking treatment for 6 months. I think engaging with that individual as a healthcare provider and telling that individual upfront that they will need to be very adherent to their treatment and take their treatment to completion is extremely important. That information is not always given to people. Yes. Like this individual that we are quoting happened to this individual. The second thing is that when people feel better, it's very easy as a human being to forget to take treatment, because within 2 weeks of starting TB treatment, most people will feel okay. And when you feel okay and you're told to go on taking treatment for 6 months, sometimes people question why they should take those medicines, and many times people forget that they need to take their medicines.
Right.
And that's why in our TB systems, we have what we call support systems. We develop mechanisms to support that individual, work with that individual until they finish their TB treatment.
Okay.
Yes, there can be side effects or adverse events, but the majority of people being treated for tuberculosis do not, in fact, experience those side effects.
Okay, Dr. Mugai, I'm concerned about the 12% that is children. Tell us more about that, and how do they fare against the medicines that I would imagine are quite harsh on their young bodies?
So children, of course, get the condition mostly from close family members, be it a mother, a father, but also relatives that may be living with children. And so we say, if we diagnose TB in an adult, you need to find out the children under 5 in that household.
Okay.
And they will be examined. If they do not have TB, we actually give some medication for 6 months, so-called preventive therapy, to ensure that they do not fall ill with the disease. However, the 12% is actually those who now have been diagnosed to have TB. Now, we are happy as a country, but also the world, that we got child-friendly medication. And so we have medication that you actually dissolve, they're dispersible. Okay. So you dissolve in water, and they're sweet tasting, so it's easier for the children. But I agree, initially, we had to cut the adult doses, crush, try and put in porridge or add some sugar to make it more palatable, but now it's better. Okay. The good news is that children fare much better, actually, in terms of outcome compared to adults. Right. It could be that, we have BCG vaccine that is given at birth. What it does is that it prevents severe disease, and we think it's protective for a period of time. All
right. Yeah. And Dr. Chakaya, as we discuss treatment, talk to us about, and it's important to point out that the person we are using as our case study actually got it from his brother, who died of the disease, and his younger sister also died. So it just points to Dr. Mungai's point of most people get it from close family members. Now, Dr. Chakaya, explain to us what resistance is and the levels that it can go, and what causes resistance to medicine when it comes to tuberculosis.
So resistance of germs to what we call antibiotics is becoming a real big problem around the world. And the TB germ is not different from other bacteria and viruses and other little things that tend to affect human beings. If you are prescribed the wrong drug regimen, combination of medicines, if you are given low doses, for example, or if you're given poor quality medicine, and very importantly, if you don't take your medicines as advised by your healthcare professionals,
right,
the TB germ is given the opportunity to overcome these medicines, and that is called resistance. Now, you could have resistance to only one medicine, you can have resistance to 2 or more medicines, and you can have resistance to all medicines. The medical profession will use terms like monoresistance, polyresistant, multi-drug resistant, or extensive drug resistance. The complexity of the treatment that you need will depend on the number of medicines that your TB germ is resistant to.
Okay.
The more medicines your TB germ is resistant to, the less able the system is able to give you medicines that can cure that disease.
All right, and then what for the patient?
Well, I think first of all, prevention is always better than cure. We really need to work very hard to make sure that we prevent drug resistance from occurring, and that means it's not just the onus is not just on the person who's being treated for TB. It's really the entire system making sure that, one, we have the right type of medicines in circulation, and the healthcare worker prescribes the right medicines in the right doses and in the right combination, and that the system helps individuals who are being given these medicines to remain on treatment, and the individual who is taking that treatment then adheres to the treatment that's been prescribed.
Right. Now, it's no secret that there's a correlation between tuberculosis and HIV. The deaths that were recorded in Kenya in 2019 were 32,000. They include 13,000 that were related to tuberculosis complications. Dr. Mungai, could you explain to this and how that transforms into stigma that might actually be affecting the uptake of treatment amongst people who have this?
So it's true, HIV was the biggest driver of TB, especially in the early 90s when HIV, was high in our country and was not well controlled. Now, due to that, a lot of people died from tuberculosis as what we call an opportunistic infection. Now, over time, the HIV field has really transformed. People are getting treatment immediately. You test positive, making sure that then you're not as suppressed. Your immunity is not as suppressed by the time so once you're diagnosed, you're put on treatment quite early. Right. And this has also reduced the deaths. I think if you were to compare the deaths by HIV TB, then, they were much higher. Now, it's true, so stigma due to the fact that when somebody gets the diagnosis of TB, then they associate it with HIV. Now, from the Kenya prevalence survey that was done in 2016, actually, only 17% of the TB patients found had HIV. Okay. So that means 83% were HIV negative. So this is to just encourage that we really must look for TB everywhere.
All right.
And if you get a diagnosis of TB, don't let the stigma of thinking that, people who think you have HIV stop you from getting treatment or even just the diagnosis itself.
All right. Yeah. Now, Dr. Chakaya, could you draw a line between, or is there a correlation between poverty, certain forms of urban settlements, and this particular disease when you look at the body of people who are often diagnosed with tuberculosis?
That's really the crux of the matter. Tuberculosis is very strongly associated with poverty. Many years ago, even Europe was poor. There was a huge number of people who were poor in Europe and in the Americas, and tuberculosis was the #1 killer of people in those parts of the world. The reason for this is really multiple. One, there's tendency for people to crowd
Right.
in poor areas. There's a tendency for people to have poor nutrition. Nutrition is an extremely important thing for building one's immunity to fight diseases, especially infectious disease. And then there's the whole issue of access to care and the quality of care that people can get from when living in poor situations. So really, at the end of the day, we noticed in Europe, for example, with improvement in standards of living, tuberculosis disappeared. Of course, it was associated with better care and all those kind of things. However, poverty is the major driver of tuberculosis around the world. And therefore, in our own setting, we in Kenya here, we really need to start looking at what happens to slums. We should not be developing in a situation where our cities are growing, but the urban poor population is also increasing, because if that happens, we will continue to have tuberculosis and many other diseases that are associated with poverty. But if we develop in such a way that there's a reasonable distribution of wealth across all sectors and there better housing and people can afford food, that alone will have a major, major impact on the burden of tuberculosis in this country.
Okay, and Dr. Mungai, 28% is the proportion of women that got the disease. I mean, what about women and, of course, mothers, pregnant mothers? Are they more vulnerable? What's the situation with that?
Yes. So TB affects people with also immunosuppression due to other conditions, natural and, medical. So in pregnancy, then it also puts at a bit of a high risk for tuberculosis. So one of the things that we do during antenatal care is actually that the pregnant women will be asked about symptoms of tuberculosis. And so if one symptom is there, they are tested for that and they are put on treatment. That way, they do well, and we also prevent. So the good thing is that now the medication we are currently using is all safe for in pregnancy for drug-sensitive TB, because we used to use the injectable, the streptomycin, which we don't use anymore. So it is safe, and the mother will do well through pregnancy. And if it's very close to the delivery period, so the baby will also be put on isoniazid preventive therapy if they have had now exposure during breastfeeding. Yeah.
Okay. And Dr. Chakaya, as we conclude, could you explain to our viewers the kind of work that is ongoing right now in Kenya, the kind of initiatives that are in place to ensure that we are getting rid of tuberculosis, and what are the chances of that in the coming few years?
So I would actually begin by looking at the political, economic situation. We were very excited in the TB world by President Kenyatta's Agenda 4, or 4 points agenda, because for us that was going to mean that in fact we're going to get rid of slums and jobs will be created and all those kind of things. And like I have already said before, poverty and TB, very bad. Yeah. We are also looking at initiatives that are intended to find people with TB early and finding all of them. If you find people with TB early and you find all of them, you reduce spread of tuberculosis in the community. And then we're looking at ways of ensuring that everyone who has been found to have tuberculosis is treated appropriately, supported until they complete treatment. And then we are also trying to ensure that every sector of every health sector, public, private, is engaged in the fight against tuberculosis.
Dr. Mungai, as we conclude, what is the what are some of the collaborations that you're making, perhaps like with other international organizations, to ensure that the battle rages on and that we win against tuberculosis?
Yes. So I think many initiatives ongoing, active case finding at facility level. We're working with the ministry, local organizations and our funders to just ensure that anyone who works in a health facility gets screened for tuberculosis. We look out to hoping that anyone who goes also to a health facility with symptoms currently of COVID can also get a TB test, because maybe some of them could actually have TB. In terms of, if you can get the sputum collected, then that would be...
Do a double test?
Yes,
okay.
that would be important, because we feel that we could also be losing people along the way. You see, getting one condition does not also stop you from getting another. And we don't know what's the correlation currently.
Yeah. And the symptoms might be the ones that are taking you for the COVID test.
Yes.
So, okay. I mean, thank you so much, Dr. Brenda Mungai and Dr. Jeremiah Chakaya. Dr. Mungai is the Director at TB and Lung Health Center for Health Solutions here in Kenya. And Dr. Jeremiah Chakaya is the CEO, Respiratory Society of Kenya. Thank you so much for helping us dissect this issue. And I hope for the viewers at home, you have learned more about TB and you shall be taking care of yourself better. Now let's move on. The global search for a COVID-19 vaccine has led to a new geopolitical race to vaccinate billions of people around the world. The race to vaccinate has, however, exposed great disparities between the rich and the poor nations in the World Health Organization, warning against the emergence of vaccines